Yep. So I'm Tommy Smith, as she just said before. I'll be a junior this upcoming year at St. John's University. I played football the last 2 years, and I'm actually really excited to start this. This is my third week here, so I can't believe I'm doing a presentation in front of people, but it's been a wild experience so far. So first off, I'm gonna tell you a little about Generation RX. I'm doing this presentation today because it means a lot to me. Growing up, there's a girl that lived down the street. I went to elementary school, there, middle school, high school, and senior year she passed away. She overdosed on heroin. And in my neighborhood, I live in a suburban right outside Springfield, Massachusetts, and you would never think something would happen like that, especially to my classmate and a girl like that. So definitely it's just heartbreaking, and it happens anywhere to anyone. So welcome to today's program. Generation RX is safe medication practices for life. You may be asking yourself, what is Generation RX? Generation RX has two connotations. First, there's a historical connotation taken from Greg Krister's book, Generation RX, How Prescription Drugs Are Altering American Life, Minds, and Bodies. In this book, Greg kind of talks about how we are becoming a drug-taking society, so taking stuff like Advil, Tylenol, that's just normalized in our society, or going to get your wisdom teeth out and taking an opioid and having doctors say, oh yeah, you need this opioid, here it is, and not even, that's just our society, it's normalized today. So in our program outline, we're going to be able to discuss the scope, the causes, and the consequences of misusing prescription drugs. We want to focus on how you as an individual can help prevent the misuse of prescription drugs. We'll do that by identifying 4 keys, and I'll bring up in the next slide. And here are some stats about opioids. Opioids are a broad group of pain-killing drugs that can be made from poppy plant, morphine, or made synthetically in a laboratory like fentanyl, which you can see, you hear in the news all the time that people are overdosing accidentally on fentanyl. So it's a real thing in this country. So every day more than 130 people in the U.S. die after abusing opioids, and 66% of drug overdoses involve opioid, meaning that 200 people who die every day from a drug overdose, 130 of them have used opioids. Let's begin by establishing the impact of prescription medications. Prescription medications can help us lead a longer and healthy life, and it has actually improved our life expectancy over years, and now we can live with diseases, and we can take these medications and live longer and healthier lives than we've ever had before. But these powerful, sometimes life-altering, life-saving medications, when used by a directed health professional, they can also be harmful, especially when they're misused. This is one of our most important messages. Not only do medications by healthcare professionals help to avoid, they monitor and care, and they help avoid harmful effects. One important thing to know, that the doctor makes the decision based on the information you provide them. So you play a huge part of letting the doctor know what your what you could be, what's the word I'm looking for? You could be someone who could be in risk of opioid addiction. So right here we have 3 scenarios pictured, and can any of you tell me which one is projecting an opioid misuse, an unsafe opioid misuse?
All of them.
Correct. So here you have the picture.
Takes one.
Give her a
Well,
minute.
worked in the pharmacy. Rude.
Yeah.
Hey, I knew about the blue, they didn't party that.
So in the first picture we have an overuse of opioid. So taking an excess amount of opioids is very harmful. And another one we have here is a friend or a family could just give you an opioid, and they might have the best interest helping you, help your back or something like that, but really it's against the law and it's very unsafe, and you never know who has an addiction, so it's not very smart to give it to a friend or family member. And the last one, alcohol and opioid usage together is very dangerous, because you can the opioids kind of make you think you are can drink more, and that can cause an overdose or alcohol poisoning, such as like that. So we define prescription misuse by engaging these three behaviors: taking more than prescribed, taking medication for a reason different than prescribed, and sharing or taking someone else's medication, like we just talked about. And our country has declared this as an opioid crisis. It's an epidemic. That's what right now, that's what we're going through. That's the epidemic in our generation, especially for my generation, kids growing up. This is what we know. Take pills for this, take pills for that. There's pills for everything. And research indicates that Americans misuse prescription drugs by taking them different ways than the prescriber intended them to do so. Prescription drugs are among the most misused substances in the United States, more than illicit street drugs, more than all of illicit street drugs combined, except for marijuana. The most commonly misused prescription drugs include opioid pain medications such as Vicodin, Adderall, Ritalin, Oxycontin, Xanax, Valium, stuff like that. And people, everyone knows people who take any of those at a given day. So, and here are some statistics about the number of drug overdoses just from 2015 and 2017 on, and you can tell total overdose every year. It keeps rising, and it's been rising for a while now, and we haven't seen a decline since. So it's definitely a hard-hitting thing in this country. So this epidemic affects us all. There's no stereotypical type. So like I said before, my friend, I could never see her doing it, but also you could never see like a parent doing it, a grandmother, but they're also, anyone can get addicted to it too. So you just never know. There's no face to opioid misuse. So I have some statistics here. 6.5 million Americans aged 12 and older reported misusing prescription medications in the past month. And 12 or older, that is insane. I can't even comprehend that. But 27% of parents report they have taken prescription medications without a prescription themselves. So even just a neighbor say, "Oh, I could pull my back. Oh, I have some leftover pain medication," and that seems reasonable, but that's why we have an epidemic going on right now, because it's the norm in our country. And 31% of teens and 13% of parents believe it's okay to take a prescription drug without having a prescription. Why is our community vulnerable for the misuse of prescription drugs? We believe there's several factors of misuse of prescription drugs. And like I said before, at first is the drug-taking culture. We've become so normalized in taking drugs for anything that it's been so detrimental to our society, and we just have to change the stigma, or at least help change the stigma. And second, because we are using so many medications at unprecedented rates, they are relatively easy to obtain without a prescription. And in fact, data from the National Survey of Drug Use and Health demonstrates that the majority of individuals that use pain medications get it from a family or a friend. And lastly, there are many misconceptions surrounding the legal and safety prescription drugs. For example, many of us don't realize that it's illegal to hand out prescription drugs, and provide to someone that might need them or say they need them. And it's just as illegal as selling drugs on the street. It's basically the same thing, if not worse. In prescribing practices, the number of prescriptions written by doctors has escalated, especially since 2012. 250 million prescriptions for opioid medications, and just in 2012. So, just a crazy amount of doctors prescribing in the last 20 years. We've identified the factors that fuel this problem, but let's look at excuse me, how we can take steps at kind of helping our community understand how misusing drugs can be bad. So first, the legal impact. In the previous slide, we just talked about the federal law prohibits possession of prescription without a doctor's prescribed note. And you can see this happening on college campuses all the time, like Adderall and Ritalin. People say they need it to study, and people will just give them out just to make a few bucks, and that happens all the time. The social impact, the misuse of medications can affect our family, friends, and our job, because it's not just you, it affects everyone around you, and it really does. So in the workplace, 53 billion per year, and 40 the economy for the whole workplace, 42 billion lost in the workplace, 8.2 billion in criminal justice costs. I'm sorry about that. And 944 million to medical complications. So this crisis is really just hurting everyone involved. And then the health impacts here. The most tragic consequence of prescription drug misuse are including drug overdose deaths, which is the leading cause of accidental deaths. Death isn't the only health-related consequence. Due to high misuse of addiction, potential certain prescriptions, opioid pain medications, emergency department visits, and drug addiction treatment admissions have both escalated in recent years. Not taking prescription as directed by a healthcare professional can result in immediate negative effects. For prescription opioid pain medications, drowsiness, confusion, slowed breathing, just stuff that you really do need. And for prescription stimulants, increased heart rate, blood pressure, irregular heartbeat, nervousness, and insomnia. And lastly, many experts attribute the recent rise in deaths resulting from heroin overdoses to the use of opioid misuse before. So 3 out of 4 heroin overdoses, they've been linked to using opioids and misusing them, which that's why we have a heroin epidemic too. It's because people get addicted to opioids first, and heroin costs about half the price of an opioid. So that's why people they're running out of money. They need to do anything to just keep that high going, which is very sad. But there is good news at the end of the day. You guys and me, we all can make a difference. Prescription drug use can be taught and helped, and as we change the stigma, I think this this country can kind of change its thoughts about using opioids and such as that. So a question for you guys, how can you prevent it at your home or a workplace like this, or just in your community in general? Do you guys have any ideas?
Properly discard of excess medications when you're done using them.
Yep. And we'll talk about that soon, how you can do that safely. Yeah, and another way to get rid of it is just doing these speeches like this. I like I said, I came here 3 weeks ago, and they said, "Do you want to give a speech about it?" And I was sure. anyone can do the speech. You read off the list, and it just talking about it creates a stigma that it really is a problem that some people don't know about, and it's good to hear. Definitely is really good to hear.
If I could jump in too,
Yeah.
like one of the things that really jumped out at me when I first looked through these slides, I was thinking back to I used to work for Medieval Times Dinner and Show, and back then, so like you have we had a bunch of guys that were stunt guys, you know, and they would jump off of horses going 30 miles an hour and whack each other with swords, which seems pretty fun on the outset, but like people got injured a lot, right? And so their doctors would prescribe them like Percocet or Oxy or whatever to deal with the pain after they had broken their wrist or sprained something. And regularly we would all go out after the show was over and have a couple beers, and they would like take their pain meds and have a beer afterwards. And it, like, I'm telling you, it never even crossed my mind that was not something you should do. I didn't know anything about it, and it just like seemed normal to me to see people like taking a pain medication and having a drink. And I think like, but that statistic that like millions of people misuse their prescriptions every day in ways that we don't even think about, like that's like that thing that seemed normal, or like, oh my friend is over, we're having coffee and she's telling me she pulled her back last night, like I'll give her one of my pain pills. Like it seems super normal to do those things. Or if you have, like, I will regularly take, if my headache's really bad, I'll take 3 Advil instead of 2, even though that's not what it says on the bottle. Like that's like, we kind of have this normal idea. And like what really got me was, most of the people who misuse drugs don't get addicted, but we set the stage because that's what is culturally acceptable for the people who are susceptible to get addicted, because we make those behaviors seem normal. And so like I've kind of realized that one thing that I'm getting out of this is I can stop acting like that stuff's normal when I see it. You know, if I ever find myself out with a friend again and I see them like pop a medication and have a drink with it, I would be like, yo dude, that's not normal, why are you doing that? Like, instead of ignoring it or acting like it's fine. I guess that's like something that kind of stuck out for me.
Yeah, and you hear stories like in the NFL that, oh, I can't play, coach, my shoulder's killing me. It's like, oh, here's a Percocet, you'll be able to play. And that's how it was. I don't think it's like that anymore, but if you've ever seen the movie Concussion, everyone who's had CTE they got addicted to the painkillers so they could play every game, and it's just a sad state of events. But we can stop this epidemic by following the 4 key safe medication practices. First, only use prescription medication as directed by a health professional. Many overdoses result from mixing prescription drugs with other medications or alcohol, but you should never mix medications with alcohol under any circumstances. Follow the dosing instructions prescribed by your doctor. These help avoid the negative effects. And talk to your pharmacist if you feel the medication needs to be altered or adjusted. This is a big one. Do not share or take someone else's medication. We've been repeating this this whole presentation because it's so important. Many factors determine how we respond to our medications. It's not just, I have this, I have that. It's based on your weight, your genes, pre-existing medical conditions, and amongst other things. But so other individuals respond different from other things. Engaging in behaviors of self-diagnosis and self-prescribing is dangerous. Always report health concerns to a healthcare professional. And regardless of intention, sharing or taking someone else's medication is not safe. Only use medication under the guidance of a healthcare professional. Keep your medications secure in a safe storage. There's disposal practices, and first we'll discuss storage. How do you safely store medication at your house? Do you guys take part in that? So there's, I know my parents, they lock the mirror over the sink, and it was, when I was a kid, it was kind of no big, like, why are you doing that? But definitely it's a safe practice, you should be doing so. when prescribed a prescription medication, store medication in secure locations such as lock boxes, medication safes, or other lockable places. Avoid storage places where children can easily access them, like a counter, cabinets, or anything like a stand that's easy access for a little kid to grab. And recall that most people misuse prescription drugs when they get them from a family or friend. Next, we'll discuss disposal. Once we finish with prescription medications, you have 3 options for safely disposing medications. One of the first options is you can take your pills and mix them around with either kitty litter or coffee grounds and throw them in the trash, because no one's going to want to take a pill after something like that. I mean, I would hope not. There's the second option. You can take advantage of community take-back programs that allow the public to bring unused drugs to a central location for proper disposal. So I know OMG, where we work in Massachusetts, they had a drop box day at one of the one day in the office, and I think it went really well. So, and there's a bunch in all different communities. All right, so if there's not a drug or take back program near you, there's a third option that allows this. And like I said, the kitty litter right here, or the coffee grounds, you mix them up and then safely dispose them. And another huge thing is taking the label off your pill bottle and discarding that, so people don't see, oh, there's a Xanax in here, I'm gonna go look for it in there. So it's very important that you take that off, or at least scribble on the label.
And then we also provide the doTERRA bags. Amy has them in HR. So if you don't have kitty litter, I don't have cats anymore. I don't have kitty litter, but doTERRA is awesome. It's it doesn't expire, so you can grab a bag and just keep it at home. And any medication that you put in there, it renders it inert. So you cut it open, you put the pills into the bag. It can even do the liquids too. And then you fill it up halfway with water, seal it, shake it, and throw it in the garbage. And even if someone got in there and pulled the pills out, they would be inert. They don't work anymore. And so, because we know that not everybody has access to a drop box, but also you can do it in the privacy of your own home. If you're worried about people seeing you, you can just grab one and quietly take care of it at home. And so we make that available, and that's Steel Partners pays for those bags, and then we send them out to all of you guys to have them for free.
What's wrong with flushing it down the toilet?
Yeah, I was just about to talk about that.
Yeah.
You shouldn't.
Oh, that's right. It makes mutant fish.
Yeah.
Yeah, you shouldn't flush them down. But however,
You're really calling that
the FDA. The FDA says you should flush some drugs that are on the list, but you can check that out at the FDA.gov. There's a couple drugs that should be disposed down the toilet, but I don't think there's many.
Yeah, I mean, and there's some theories that so as they test water in various places and they find rising levels of those drugs in the water source, and and then we're drinking that water and eating foods grown in that water, and there's some thoughts that it might even make us more susceptible to addiction to those drugs because we're exposed to it through our drinking water and our food. So
That doesn't make me comfortable with my sewer water.
Yeah, I mean, and it gets into the water that animals drink. It gets into they find all kinds of weird.
Well, they found in New York, birth control and fish, where
Right.
the fish have turned into mutants because people are flushing too many drugs down their toilets.
Really?
Yeah, I've read that.
Futurama.
So I really just kind of brought that up.
Yeah.
As should do.
No, that's a really good point. That's a really good point.
Yeah.
Yeah, birth control, just eat the the fish.
They found mutant fish, they found in the Hudson River.
There's
That
another.
doesn't
there's
surprise
another-
me at all.
Fish, next thing you know. All I can visualize right now is Futurama, where they've got like the mutant
Yeah.
society in the sewer.
Lastly, be a good example for those around you. After listening to this, you have a little more understanding than you did before, I would hope, or maybe you know it already. So just discussing it with other people, coworkers, family, friends, that's the most important thing to take out of this today. Yeah, just educating others. We encourage you to do this presentation for other locations like we were doing today. You can take action in your community by educating others about this issue as well as safe medication practices. You can visit our Generation RX website to access free, ready-to-use resources.
And I will say about that, the Generation RX website, so we didn't make this presentation. We got it from the generationrx.org. They've put an entire organization together around this concept that it's like this cultural norms that is setting the stage for a lot of problems. But one of the, like, they have ones that are for seniors. So if you have a senior center or aging parents that are in a center, you can give a presentation there for them. And actually a lot of accidental overdoses happen with seniors. Who like either don't realize how many pills they've taken in a day, or they don't understand that they shouldn't be taking more than what's on there if they're having a bad day, and so and then there's one for teens, and schools and teen centers and if you have kids in your life that you think even the kids could give the presentation themselves, like the whole script is written in the notes here. And they do that with all of their products. And, like 12 years old isn't a joke. That's a lot of the kids that are in these homes are getting like their first encounter with these prescription medications are from their own medicine cabinets from their parents, starting at like 11 and 12 years old is when they start, and then they're addicted by the time they're 13, 14, and then getting into these programs at 15, 16 years old. And so it's starting young. And like, again, it's like, cultural. It's not about bad kids or bad parents. It's just, it's there and it's what everybody else is doing. So.
And then here we have a checklist. This is basically for you to understand what are the risks that go into maybe having an addiction. So I can pass these around. So, like we said in the first meeting, you're not always going to have this pamphlet on you when you're going to the doctors or whatever. So if say your kid got injured and you're going to the doctors and you can't be there because I forgot my pamphlet, you could take a picture of this checklist and always have it handy on you so you know what are the risks of being addicted and potential opioid misuse in the future. And there's a lot of things that you would never believe, like ADHD is if you're taking ADHD, you're more prone to becoming addicted to opioids. So there's just a lot of things in there that you would never know. So if you are prescribed a controlled substance, use as directed and dispose properly. Inform your healthcare provider if you have trouble discontinuing your medication. And keep your checklist, like I said, and it's good to take a picture of it because I know it's hard to carry a pamphlet around all the time, but it's definitely know your checklist and make sure you're up to date on that. Does anyone have any questions?
It was interesting. I just got a USA Today alert. I don't know if anybody else gets these or not. So the USA Today alert that just popped up on my phone says 2 brothers hockey players dead on the same day of opiate overdose.
Oh.
Horrible thing this morning. 18 and 19 years old, both hockey players. Mother found them overdosed. That just came on while we were having this discussion.
That's horrible.
One of the things that was really, I brought it up at the 10 o'clock session, but so surprising to me is that, we do all these things to protect our children, right? And for me, it's when they're out in the street or at school, we're trying to make sure that they're safe. But you guys said that most children get their first access from medicine cabinets at home.
Right.
Would have never thought of that.
Right. Well, and you said like, that I think we all have that natural instinct of like, I paid for this. What if
I'm gonna save it.
I'm gonna save it? What if the apocalypse happens and I'm the one with the meds?
What if I hurt my
Right?
back? What if my back hurts?
Yeah. What if I fall again? And whatever. But I guess that too is it that you just brought up 2 things. One is that habit that we have of hanging on to things even after we don't need it anymore. Quote, in case of an emergency. But if we look at like the legal side of things, it's actually illegal for you to take your own medication that you were prescribed for something different
Right.
for the new injury. You have to go get a new prescription for your new injury all over again because the doctor might prescribe something different this time around and you don't know. And but it's so opposite to how we usually think about things. Like I remember like going through my mom's medicine cabinet with her and finding prescriptions from like the 80s that she still had. And I was like, why is this here? And she's like, I saved it in case we need it again. But now, I forgot about it and it's just hanging out there. Like, got me.
That's what makes them eat fish.
Prescriptions from the 80s.
Just 20 years old, just toss it.
If I open up this little thing of cold medication, it won't even come out of the bottle anymore. It's so congealed
That's
in
my
there.
grandma's pantry. It's like this is from the 90s. Why do you have this can? It can't be good anymore.
I think one of the things so this pamphlet we did have made just for Steel Partners for us for our presentations, and the reason we did it was I don't know about you guys, but in the moment of a crisis, that's not when I'm great at thinking through things for the first time. If I'm injured or someone I love is injured, I'm not sitting there being like, whoa, doc, before you make my loved one not have the pain, that they're in, let me go through this checklist with you. It's actually really helpful to go through these things ahead of time. And especially with aging parents, to go through this with them, but also for kids, take a picture of it. Think through the questions now so that you don't have to think through them in a moment of crisis when your adrenaline's pumping and you haven't had a chance to go through it. And the other thing that struck me about this checklist when I went through it was, I was like, these are the risk factors. This is literally everybody on this list is somewhere. And then it occurred to me that that's that's why this is a problem, because we're all at risk.
One of the things that got brought up per question at the 10 o'clock too was the questions for the doctor. Does anybody not question a doctor?
Every time.
Do you?
Oh, yeah.
Good for you, because
I
my
always
mom
question
does
the
not.
doctor.
And when you ask her questions, well, the doctor said. But why? Well, I don't know, the doctor said. So we have this generation of people who, I guess it's not generational.
They're always practicing medicine.
Yes.
Practicing.
You just
The
don't
operative
ask
word, right?
questions.
Right, and that was one of the things is it says, you're only supposed to use the medication as prescribed, but if you're not providing enough information to the doctor for them to prescribe it to you correctly, then you're not taking it technically how it should be prescribed. And that, I think, is to your point. If you have especially with certain parents or people, certain cultures, that don't question the doctor, but also, I was saying, my grandfather used to be like, the doctor is God, I could sit here in silence and he'll know exactly what's wrong with me. And my mom would be like, Dad, did you tell the doctor this? No, I didn't say anything. If that was a problem, he would have told me. Well, you didn't even know that you were feeling it. He's not a mind reader, but my grandfather genuinely was like that, and anything that the doc said was was word and I was sharing earlier that I have the opposite problem when I go to the doctor, in that I've already like Googled every single symptom that I've had, and I come in with my ideas of what I think is wrong with me, and the doctor is a little bit like, oh my God, this crazy lady, like please stop trying to be Dr. Google and let me tell you what's wrong with you. And like, so I think that like culturally speaking, both groups need to be better at talking to each other. We need to be better at sharing with our doctors what we know about ourselves, and they are working on changing their culture of listening more to their patients. Talk to them before prescribing. So that's what the checklist is for.
I'm almost a doctor. I've watched a lot of episodes of Grey's Anatomy.
Yep.
Well, I watch House.
Yeah.
You watch. What do you want to talk about? What did you watch?
I'm also an addict. Who's in there?
I'm watching House over here, so I can tell you all of it.
Medical marvels on Lifetime. I know everything.
Yep, that's all I have for today, so.
Thank you.
Thank you.
Great job.
Thank you guys.